There is controversy surrounding the relationship of early childhood vaccinations and the development of autism. It's been studied very, very extensively on both kind of clinical, anecdotal, and more scientific epidemiological bases, at least at the level of population statistics. The best experts in the field really do have consensus that vaccinations of MMR, vaccinations around the age of 2, are not causal for autism. There is controversy, and many would say case closed, that vaccinations don't cause autism. On the other hand, they are at the level of population statistics, and there are many things in medicine and in science that can work at the level of the individual. A very specific rare genetic mutation, for example, conceivably could interact with antibodies or the vaccine or agents within the vaccine media to produce neurological or even other medical problems, for example. But there just isn't evidence for it. So because that would be such a rare event, it's very difficult to marshal evidence that would ever demonstrate it. So it's really and that would ever refute it. So it's really, if that does exist and is possible, it would be very difficult to falsify that it's happening in individual children. And again, at the level of statistical populations, it seems not to be the case. I think the difficulty is that it's a temporal concurrence of the time in childhood at which these symptoms emerge, and they're most evident around the age of 2 or 3, when children typically are becoming much more social, or should be becoming much more social, and parents begin noticing that something terrible is wrong with their child. They may in fact be losing skills that they had started to acquire, a sort of regressive form of autism. And that's happening around the time that they get vaccines. And when two things go together in time, people inherently, naturally say A causes B, even though it's just a temporal concurrence, literally a coincidence in time. But it doesn't mean that A causes B.